Headache due to weather changes. Why this happens and how to help yourself. Weather-related headaches reduce productivity, make us irritable, and force us to take painkillers for years. If you are a weather addict and think that you are doomed to adapt to the weather all your life, this is not so. The connection between weather and headaches. When the weather changes, weather-dependent people experience severe headaches, dizziness, and nausea. In this case, the weather factor is the trigger that causes deterioration in well-being. The cause of headaches lies not in the weather, but in existing disorders of the body. For example, a person has impaired vascular wall tone. When the weather changes, atmospheric pressure increases or decreases. Changing atmospheric pressure, in turn, naturally changes the pressure in blood vessels and tissues. When atmospheric pressure increases, blood flow increases, the vessels must dilate. When atmospheric pressure decreases, blood flow slows down, the vessels should narrow. Vessels with altered wall tone cannot quickly adapt to the situation. The supply of oxygen to brain tissue is also disrupted, to which the body reacts with headaches and a possible change in blood pressure. People who have stressful jobs or are under chronic stress are sensitive to weather changes. Their blood vessels are in spasm due to the production of stress hormones. During a spasm, as well as when there is a violation of tone, it is difficult for the vessels to quickly expand or contract. The work and nutrition of the brain depend on the circulation of blood carrying oxygen. The brain consumes approximately 25% of the oxygen we inhale. If the lumen of a vessel narrows or becomes blocked, oxygen starvation occurs in some areas of the brain. This increases the risk of stroke. Vessels lose elasticity with increased blood sugar, excess weight, and liver problems. At the same time, the fat composition of the blood changes and metabolism is disrupted. If a person goes outside and feels a headache due to a sudden change in air temperature, this is not a serious pathology. This is the body's reaction to temperature indicators. There are receptors throughout the scalp. With increased sensitivity, they can be overly irritated by the cold, which can lead to headaches. To prevent this, it is important to wear a hat. Step-by-step instructions for dealing with headaches. If you suffer from weather-related headaches, you should consult a neurologist. Because when you take painkillers on the advice of a friend or an advertisement, you eliminate the feeling of pain, but not the cause of this pain. And the situation repeats itself from storm to storm. With long-term use of painkillers, the pain develops into chronic pain. It is present on more than half the days of the month over the past 3 months. Pain associated with overuse of medications may also develop. A neurologist is able to determine the cause of the headache and prescribe adequate treatment, after which it will disappear from your life without harm to health. At home, I recommend jogging, brisk walking, swimming 2 to 3 times a week during intense physical activity. Heart rate and blood flow increase. The vessels dilate so that blood can circulate normally. At the end of the workout, blood flow decreases and blood vessels narrow. In this way, both blood vessels and muscles are trained. Practice contrast shower. Alternating water at different temperatures forces the vessels to expand and contract. Go for a massage or do self-massage of the cervical region. Neck and back massage relieves muscle hypertonicity and improves blood flow to the brain. Walk outdoors as often as possible. Walk to work through the park. Go to the forest or mountains on weekends. Saturate tissues with oxygen whenever possible. Eat foods containing succinic acid, bananas, sauerkraut, grapes, apples, Brussels sprouts. Succinic acid is the main amino acid of the brain. It improves tissue respiration and the transfer of oxygen from blood to cells. And speeds up metabolism. Alternate work and rest. Learn not to stay late at work and not open work chats, for example, after 2000. Do not work on weekends unless absolutely necessary. Get enough sleep. Try to go to sleep and wake up at the same time every day. Sleep at least 6 hours a night in a well-ventilated room. With chronic lack of sleep, the body reacts sensitively to any external factors, including weather changes. Take care of yourself and do not endure pain that you can get rid of.